What can we do when toothache strikes in the middle of the night and you can't reach a dentist or have no medication? I'll teach you a handy trick. 3 Acupoints to relieve tooth pain in emergency situations. In this video, I share my personal experience and insights. I recommend trying these techniques as complementary therapies. However, if your condition is severe or your pain persists or worsens, please seek timely medical attention. Welcome to Eat, Play, Heal with Yogi. Well, just as my back pain subsided, my toothache has started again. Well, at least learning some knowledge of Chinese medicine over the years hasn't been in vain. It comes in handy to practice and test various remedies anytime, anywhere. Even when I fell ill with COVID-19, instead of just suffering, I was able to review and reinforce my knowledge throughout that painful week. I have a class case of what they called a cold constitution combined with being deficient and hard to replenish. Basically, I easily get an excess of internal heat if I accidentally consume something that generates too much warmth. This usually leads to toothaches. I also have a slight obsession. I had 4 wisdom teeth, and as they became inflamed and caused fever, I gradually had 3 of them removed. But I always feel like if I lose that last one, it's as if I'll lose my wisdom entirely. Of course, there's no scientific basis for this belief, and I understand the logical reasons behind it. But I just can't gather the courage to remove that last tooth. So it's usually this one causing trouble. To combat the effects of cold and dampness and warm up my body, I start each morning with a cup of ginger tea. It's not easy that I've found a specific ginger tea that I've been consistently drinking for over a year without experiencing excessive internal heat. However, I suppose it has reached the maximum limit of heat my body can tolerate. On top of the ginger tea, if I give in to cravings and eat something spicy or have something like lamb, or during the rainy season when dampness becomes a problem, seems my body just can't handle it. And my last wisdom tooth will start throbbing and swelling. What's more, once it starts acting up, it takes at least 1 or 2 weeks to subside. During the acute phase, I would experience pain all over, including in the lymph nodes in my head. It makes me upset all the time. And after the acute phase, there's a lingering dull pain, and I can't chew anything, only swallow. So I'd mostly rely on a bland or liquid diet to get through those periods. Before I started learning acupuncture, I struggled to find effective solutions for my problems. I'm not a fan of taking Western medications unless it's absolutely necessary. Some people resort to metronidazole at the first sign of a toothache, but the drug comes with a host of side effects and shouldn't be taken lightly. Personally, I'd rather to endure the pain rather than rely on medications without careful consideration. I've tried various remedies like anti-inflammatory mouthwashes and sprays, but they haven't provided much relief. The underlying issue of internal heat and toxins needs to be addressed from within, and simply suppressing them externally has limited effectiveness and may not be the best approach. I remember one time when I took my mom to visit Guizhou province. Being an elderly person, she tends to worry a lot. As soon as we mentioned going out, she couldn't sleep well for several days, and even before we set off, her tooth started throbbing faintly. We were in a bit of dilemma because a significant part of her trip to Guizhou province was for the food. And Guizhou province is renowned for its spicy cuisine, with over a dozen varieties of premium chili peppers. If she couldn't eat or drink there due to toothache, how would we manage? Thankfully, I had just started learning acupuncture at that time, so I quickly packed a few boxes of needles. I wasn't sure how effective they would be, but I thought I'd figure it out once we arrived. During our time in Guizhou, the first thing I did every morning was give my mom an acupuncture treatment to alleviate any potential tooth pain, regardless of whether she currently felt any discomfort or not. It was a preventive measure. Surprisingly, throughout the duration of her 10-day trip, I would administer the needles in the morning before embarking on our day filled with spicy food adventures, and the next day my mom had never experienced any tooth pain. With this early prevention and timely treatment approach, we enjoyed our trip without any tooth problems. We returned home happily, having savored the delights of Guizhou province, all kinds of spicy cuisines. From then on, although we would occasionally experience tooth pain due to excessive internal heat, knowing that I had acupuncture needles at hand gave me a sense of reassurance. As I became more skilled in acupuncture, I started incorporating the visualization techniques. During the process of inserting and twirling the needles, I would concentrate my full attention and focus on a specific location of the pain. I would then mentally guide the needle sensations to the painful area, perceiving the changes in the sensation of pain. For example, when I experienced toothache and applied acupuncture, my focus would be on the throbbing sensation in the roots and gums of the affected tooth. After a while, I could feel the throbbing sensation, which was previously pulsating and causing intense discomfort, suddenly ease away at a certain moment. Of course, the pain would still persist as it was during an active phase, but the effectiveness of the needle became apparent, giving me the confidence that the recovery would accelerate. It's important to note that this method provided temporary pain relief during the acute phase, focusing on symptom management rather than addressing the root cause of the toothache. It is a targeted approach to alleviate immediate discomfort. For individuals like me who frequently experience toothaches due to internal heat, this technique is suitable for emergency situations. It can be combined with adjustments in diet, sleep patterns, and emotional well-being to support recovery and reduce the frequency of episodes. However, it is crucial to seek professional dental care for comprehensive treatment if tooth extraction, fillings, or other dental procedures are necessary. Acupuncture or stimulating acupoints can offer temporary pain relief, especially in urgent situations when immediate access to a dentist is unavailable. Nevertheless, it is important to understand that these methods should not be seen as substitutes for proper dental care. And to be honest, when a toothache strikes, especially during a severe episode, it can be incredibly distressing, making it difficult to find a peace of mind to administer needle treatment. However, we are fortunate because the three main acupoints that can provide relief are all right at our hands and forearm area. They are all convenient to access and easy to apply pressure to. That's a silver lining amidst the unfortunate circumstances. The first and most versatile acupoint is called Hegu, also known as the pain eliminator acupoint. The Hegu acupoint is considered a remarkable point known for its pain relieving properties. There's even a case covered by BBC in 2005 where doctors at Renji Hospital in Shanghai used acupuncture on Hegu along with other acupoints to provide anesthesia during a heart surgery for a 21-year-old girl. 面口合谷收 is a well-known T.C.M. saying that highlights the effectiveness of Hegu acupoint for treating various head and facial pain conditions, such as headaches, eye pain, toothaches, and sore throat. Within the Hegu acupoint, there's a remarkable subpoint called the toothache Hegu. It lies on the side where the bones are nearly intersecting, specifically addressing toothache. While acupuncture is normally the preferred method for acupoint therapy, it may not always be practical for everyone to needle themselves or to find someone available to help. In such cases, manual pressure or using tools for stimulation is a more common approach. For the toothache Hegu acupoint, which is located near the bones, may not be suitable for needling. Then you can use the pad of your thumb to apply pressure to the acupoint for about 1 to 2 minutes, followed by gentle circular rubbing in a clockwise direction. However, there's one important precaution. Pregnant women should avoid needling the Hegu acupoint. This is because Hegu has the potential to induce uterine contractions, and excessive stimulation could lead to contractions and increase the risk of miscarriage. Therefore, it is advisable for pregnant women to refrain from stimulating the Hegu acupoint without proper guidance from a healthcare professional. Now let's talk about the other two acupoints on our forearm, Zhigo acupoint and Neiguan acupoint. The Zhigo acupoint is located on the back of our forearm, about 4 fingers width above the wrist crease, between the ulna and radius bones. It can be pressed to alleviate toothache, gum redness, and swelling caused by excessive heat in the digestive system. On the inner side of our forearm, about 3 finger widths above the wrist crease. Between the ulna and radius bones lies the 内关 acupoint. When you make a fist, you notice two slight indentations where the tendons are. The acupoint is found in those indentations. Applying pressures to the 内关 acupoint can provide relief from toothache, gum inflammation, symptoms of fever caused by internal heat, and help calm the nerves, reducing restlessness due to pain. You can also consider applying pressure to the corresponding acupoints on the opposite side of the body, using the principle of treating the ailment on the right side with acupoints on the left side and vice versa. But if it happens to be a toothache in the front teeth, then it's best to consider both sides of the acupoints. In addition to these three key acupoints, there are others that can help with toothache as well. For example, pressing on the 颊车 and 下关 acupoints on the face can help relieve pain. Regular stimulation of the 下关 acupoint can even have a cosmetic effect. Moreover, toothaches can be further categorized as upper or lower toothaches. And for upper toothaches, targeting the 足三里 acupoint on the stomach meridian can be beneficial. It is also worth considering the principle of treating the upper by using points from the lower. In this case, the 合谷 acupoint and its paired point, along with the 太冲 acupoint on the foot, can be taken into account together to enhance the effectiveness of treatment. However, speaking from my personal experience, when a toothache becomes really painful, I'm not particularly eager to add more needles into the mix. In those moments, all I want is a simple and quick solution. So I found that taking proper care of these three key acupoints on my hand, focusing my full attention, and either inserting needles or applying pressure to these points is the most effective and accessible method I have found for immediate relief. And I must say, the results have been quite satisfying. During my recent toothache episode, I inserted 3 needles and immediately felt a significant reduction in the sharp pain, transitioning into a milder discomfort. After the needling, I also prepared and drank a bowl of mung bean soup to help reducing the internal heat. And the following morning, I actually forgot about the toothache. It was not until the afternoon I began to feel a slight lingering discomfort. So I repeated the needle stimulations on the 3 acupoints. I continued this routine for 3 to 4 days. As the intense pain subsided almost immediately on the first day, the subsequent days were dedicated to the recovery phase. Without causing any disruption to my daily life and work, I was genuinely pleased with the outcome. In this video, I share my personal experience and insights. I recommend trying these techniques as complementary therapies. However, if your condition is severe or your pain persists or worsens, please seek timely medical attention. Join me as we learn how to apply the principles of T.C.M to our everyday lives and live a happier, healthier life. Please like, share, and subscribe. Thanks for watching, and see you in the next one.